I used to be in the club. So I used to be, like have my Democratic policies. And then I was kind of a dissenter during COVID in the sense that my real interest is in poverty. My real interest is in disparities between rich and poor. And this response deepened the disparities between rich and poor. It was deeply unfair to the poor of shutting down schools where people could go to private school if they had means, of shutting down businesses where people who had money could stay home and do their computers and laptop work. And it also thrust 100 million children each year of 2020 and 2021 into poverty worldwide. So because I'm really interested in poverty, that's just my main interest. I was out of sorts with the Democrats because they deepened poverty during this COVID response because they were mad at Trump and all that. But they deepened poverty. It was deeply unfair. Yeah. And my patients are poor. So I would see all these effects because I treat a publicly insured patient population, and they'd say, are your children in school? And I'd say, yes, I'm in private school and they're in school. Yeah. And they'd say, really? I cannot, those public schools will not open. Can you fight for us? Can you fight for us? And so they didn't have any way to send their children to school. And there were 8-year-olds. One person in my clinic who works with me, her 8-year-old would be home alone so she could come and work as a staff member in our clinic. And the 8-year-old would be home alone on devices. On devices. Yeah. It was so sad. And then when I was in India, there would be a son and a daughter in a family, and they'd have one device in a family of the driver, and so someone who was low means, and the device would go to the boy, and then the girl would be out of luck. So one device in the family. So only boys got online school.
So I see.
Yeah,
I see.
So that all that playing out in India too.
So it's vastly increasing the disparities that were already
vastly increased
terrible.
Disparities. And I went into infectious diseases because I was interested in disparities between rich and poor. So but my point is I became a dissenter. I really didn't think this response was right, especially around school closures.
Let's use the term that the left will use. You're a heathen. You committed heresy.
Yeah.
You should be excommunicated from the tribe.
Right.
You're self-promoting. You're wrong about everything.
Yeah, that's what they say. Yes, those leftists. Yeah. And what happened then is because I'm super left, but then I violated the left in that way. They were attacking me, like you said.
Right.
And I realized for the first time that you can have a variety of opinions. They don't have to be in one tribe.
Heaven forbid.
In fact, you can just have a principle that you believe in. So I have like 2 principles I believe in. One principle is I'm really desperately unhappy about global poverty. And about disparities between rich and poor. That principle drove everything I did. I'm also really interested in the concept of human companionship and human togetherness and connection, because not just because all primates need connection, but because I've seen firsthand the stigmatization of people who are gay, who live with HIV, and what social isolation and stigmatization, and telling someone that they're dirty because of their inherent something about them, which is sexuality. They were dirty and they needed to stay away from people. And that's what we told people during the pandemic about breathing, that it was dirty to breathe. Yeah. And so you had to cover that breath, and you had to stay away from your grandparents, and you had to stay away from human beings. And by telling that, we created fractures and misery and more anxiety and depression. And we're now at our highest suicide rate that we've ever had in the United States. And mental health effects on children are unfathomable. And that isn't the right thing to do. That's not holistic public health. That doesn't think about despair and other aspects of public health.